Hello, everyone, and welcome back to the Unpaid Clinic podcast. I'm Jillian, the clinic manager at Unpaid Clinic, and today I am joined with one of our amazing physiotherapists, Jide. Hi, Jide.
Hi, Jillian. How are you?
I'm good. How are you?
Good to be here.
Thank you for joining me. I am so excited for this episode. I really am. Today we're talking about something that is pretty close to home for me. From personal experience, we're going to talk about cortisone shots, and we're going to talk about kind of why people get them, maybe why you shouldn't, and lots of reasons why you should try some other modalities like physiotherapy and shockwave therapy before going to a cortisone shot. And like I said, I'm really excited for this one because I actually had a cortisone shot when I was 15, and it caused a lot of different issues personally after that. I wish I would have probably done a little bit of physiotherapy or something else, because that was the first option. I actually wasn't given any other options. We just did cortisone. So we'll get into that later, but let's start right off the bat with, for anyone who doesn't know, can you tell us what cortisone is?
All right. Thanks, Jillian. Again, my name is Jide. I'm a physiotherapist and shockwave therapist at Unpaid Clinic here in Edmonton. I've been a physiotherapist for a while, and this is a topic that we definitely come across from time to time, cortisone. Patients, who've had lots of pain and intractable pain, and they're at their wits' end, and they just desperate to get out of the pain, right? So they all get offered cortisone, and they typically just jump at it. And so today we're here to try and shed a little bit more light about, excuse me, a little bit more light on what cortisone is. So cortisone is a medication, belongs to a class of drugs known as corticosteroids, and they have very broad application in medical practice in medicine, including treating immunological conditions like rheumatoid arthritis, treating conditions where you have like a flare up or respiratory issues like acute exacerbation of COPD, asthma, even in some cancer treatments. Typically, anytime you're trying to just suppress the immune system or a very exaggerated immune response in the body, it tends to be used. Now, in the realm of musculoskeletal conditions, which is where we come in, it's also typically used for treating, again, intractable, severe, debilitating joint pain and back pain. And so when the patient goes to see the doctor and say, we've tried pretty much everything and I can't function, they get offered cortisone. And what it does is it suppresses that immune response. So your immune response or the inflammatory response is how your body responds to an injury when your body is trying to heal itself. But often this response is in overdrive and, goes out of control. And so you're having so much pain. And so the idea is to try and suppress this response so that you can have less pain.
Right. Yeah, you said right off the bat that we see this a lot with patients, and that's a huge reason why I wanted to do this episode and have this conversation, because I do the front desk at Unpaid, and I get that call probably at least once a day, is someone asking, I've had a cortisone shot, how long can I wait for shockwave, or canceling appointments because they just got cortisone, or asking if they can have shockwave or if they should do cortisone. And so it's something that a lot of people are offered at the doctor because they're in that much pain that we see on a daily basis. So why would you say maybe try something else first? Why would you not recommend cortisone right off the bat?
Okay, yeah, good question. So cortisone typically is trying to treat the symptom, right? You're treating the symptom. And again, I get it. Patients are desperate. They just need to be out of the pain, even if it's for, a few days or weeks or months. They just want the pain to stop or at least subside significantly so they can actually have a life and function and not be in pain all the time. But the problem is that cortisone does not treat the underlying problem that you have. And it's usually, when you're talking about joint pain and back pain, it's usually a structural problem. right? And it's not helping the body to heal. It's just suppressing that immune response that is, or that inflammatory response that's in overdrive. And
Right.
so while you have short-term gains, or potentially you could have short-term gains, sometimes you don't, but you can have short-term gains, but you're not really treating the underlying problem. So it's not a long-term strategy for treating joint pain. Also, there's a lot of um, deleterious effects with long-term use of cortisone. So again, it's not a good idea to use over and over for treating joint pain. And I
Right.
can,
Yeah.
yeah,
Go ahead.
and you could have, so I mean, I can start to list some of the adverse effects of, especially of long-term use of cortisone. So number one, it suppresses your immune response. Remember, it's trying to suppress that system. And this is also the system that your body uses for fighting infection and things like that. So if you suppress the system, then you're susceptible to infections. So also, so you can have opportunistic infections, but you can also have infection as a result, directly as a result of the injection itself, especially if, the techniques were not very sterile. And I've seen cases like that where a person has had, this debilitating joint pain, they can't walk, they can't function, and they've tried a bunch of different therapies. Finally, they got a cortisone shot, but unfortunately, from the shot, then they get septic arthritis. And sometimes it could be just in the one joint where the injection was administered, or sometimes it can be in multiple joints. And I've even seen cases where it went as far as even causing cardiac or heart damage. So, where they get infective endocarditis affecting one of the valves in the heart, and then they had to end up getting like a mitral valve replacement or something, a
Yeah.
very life threatening condition, right? Just
Yeah.
from, the shot. Other adverse effects would be like, again, I'm speaking more long term. You can have weakening or damage to your connective tissue. So the very connective tissue that you're trying to treat, so ligaments, muscles, joints, cartilage, it starts to weaken them with repeated administration of cortisone. It could also weaken your bone, especially in localized area of application. It could cause nerve damage. It could cause hyperglycemia because glucocorticoids typically cause release of sugar into your blood, of glucose into your bloodstream, and your body is not able to absorb them. So with repeated use, you can start to have more hyperglycemia, which is why patients with diabetes have to be careful using this. If your patient also has are on anticoagulation, um, so blood thinners, you also need to be careful because this could cause bleeds. So patients with conditions like hemophilia, for instance, where you tend to bleed into your joint, yeah, it's actually a contraindication for using steroids. And then it could also lead to high blood pressure over time, and could also cause changes in your skin and in the face. So thinning of the skin and things like that. So yeah, so there's a lot of uh, you know adverse effects of repeated and prolonged use of steroids. So it's something that people should know um, before dabbling into it, because I feel like people are not really aware of these.
Absolutely. And I think a lot of people, um, they, like you said, they're in so much pain. So they go and get a cortisone shot because it's the only option to get them out of that pain instantly, which I can sympathize with. That's awful. But then it almost becomes like, well, that worked. I'll just go get another cortisone shot a year from now when it starts, hurting again. And the problem is you are just masking it. You aren't actually fixing the issue, and then also are opening yourself up to all these adverse conditions.
That's
So
right.
that's some of the limitations, I guess I would say, um, to using cortisone. So that's where we kind of come in and say, well, maybe we should try and fix the issue long term versus using cortisone for forever. So, what does Shockwave do? Let's switch gears for a second.
Okay, so shockwave belongs to what we call special acoustic wave or sound waves, energy. So you find them in nature in things like the aftershock of an earthquake, So anytime you have a massive explosion in nature, so like again an earthquake or lightning, um, then shock waves are typically released. Um, and so in medical science, somehow we found a way to generate this same kind of energy in smaller doses and be able to target tissue with it. And what it tends to do to your tissue is it tends to interact. First of all, it has that mechanical interaction with your tissue as it travels through. So if there's tissue restriction, it can actually loosen that up and break that up. But also, it tends to communicate and interact with your cells in a way that sets up a cascade of events that ultimately seems to um, recalibrate your immune response and your inflammatory response to injury in a way that your body actually starts to heal itself. So it mobilizes the resources to the region where it's needed. And sometimes, because the problem with inflammation is sometimes when you get inflammation, it's too much or too little. And somehow Shockwave is able to recalibrate that to a level that is optimal for healing to occur. And so, in addition to its mechanical effect of loosening up tissue restriction, this communication and interaction with your cells tends to have that long-term effect of tissue repair and restoration and regeneration. And the great thing about shockwave is it's non-invasive. So, and with the doses that we use, it's pretty safe
Well,
to use.
that's the other thing is there's not a lot of conditions where you can't have shockwave, and not a lot of adverse effects that come from shockwave, right?
Exactly, exactly.
Yeah, because it's
Especially at
making
the
your own
doses that.
body.
So if you use that at the higher dose, just like anything, in healthcare and medical science, anything can be toxic if you use it at the wrong dose, right? But at the doses that we use, it's pretty safe. So at a much higher dose, shockwave is actually used in a procedure known as lithotripsy in breaking down kidney stones. But
Yes.
that's very, very high dose, and we don't come anywhere close to that. So,
Yeah.
yeah.
Um,
Yeah.
so so just now we've kind of talked about cortisone, we're talking about shockwave. Cortisone is obviously a more short-term effect or short-term relief, right? You're probably going to need more than one in your life, or maybe you do it and hopefully come and get physio or shockwave after. How long does shockwave last? Is it short-term? Is it something people have to do for the rest of their lives, like a cortisone shot?
Um, so it depends on how advanced the condition is. A lot of factors are played. The general state of health of the person getting the treatment, their age, their again how advanced the situation is. Is it like mild? So, say arthritis, for instance. Is it mild arthritis? Is it moderate? Is it advanced arthritis? But regardless of the case, shockwave will give some relief. It may be complete relief. It may be partial relief. It depends on the patient and the case. Um, and so, what I tend to do is do a series of 3 to 5 treatments, see how the patient responds to it. Sometimes the patient says, "I feel great," and that's good, and that's permanent, and we don't need to visit that again. And again, they monitor themselves. If things start to say return down the road, they may need like a tune-up treatment. But sometimes the condition when we have very severe or advanced arthritis, for instance, I'm just giving an example now. Then what you're hoping and the expectation right at the outset is we discuss with the patient and say, we're not trying to cure this, okay? What we're trying to do is to mitigate the pain enough that you can function. And shockwave can cause a little bit of remodeling around the soft tissue and the joints, enough that you can function. And then once we attain that, then what we'll do is start off with like a maintenance program where you're coming in maybe once every few months, once in 6 months, or once a year for like a tune-up treatment, just to keep you going so that you don't regress back to where you were. So, but it's just like with any treatment, it's not a an all be all, right? But um, with the kind of results that we've had with Shockwave, it's pretty remarkable. And it's almost certain that you have some relief, whether it's just mild relief or significant or total relief depends on the case.
Right. And so I guess like in some cases it is more short term. In certain arthritises, it might just be to manage pain. It might not heal. You might still need a knee replacement down the road. But the difference between using Shockwave as something to manage pain versus cortisone as something to manage pain is the effects that it has on your body, right?
That's right. It's actually treating the underlying problem. It's not just treating the pain and the symptoms, but it's actually causing your tissues to repair itself. And if there's any tissue restriction, like restricted muscle contracture, joint capsule tightness, you can loosen all that up with the shockwave energy, whereas cortisone does not do that.
Yeah, cortisone is just going to make your body not think it's in pain, right?
Yeah, exactly. And sometimes because you think that oh, this suddenly feels better, you remember pain is a warning signal that your body is telling you there's something wrong here. And so
Right.
when you mask or suppress that feeling, you go about your day to day, causing more damage to that structure that's already weakened and damaged. And then when the effect of the cortisone wears off, now your pain comes back 4 times worse, right?
Yeah. Oh, exactly. Because you think it's when I got my first concussion, I was told I wasn't allowed to take Advil because of that reason that, like, your headache means that your brain is not okay. And if you take
Mm-hmm.
Advil and go run around, you're going to end up having this concussion for longer. So that's kind of exactly, just layman's terms, but more you don't want to take a cortisone shot, go and do a round of golf or go play your sport because you want it right now because you're going to end up feeling worse later. And
Yeah.
then you're going to need another cortisone shot that probably won't last as long as they go on. Does your body start to accept it and it starts being less effective?
Mm-hmm. Sorry, say that again?
Does your body start to accept cortisone the more that you have it so it starts being less effective?
Yes, you build a tolerance
Yeah.
to, so two things. You start to build tolerance to any drug, right? Any drug that you take, if you keep taking it over and over time, you tend to build a tolerance. But also remember that, again, there's ongoing wear and tear in whatever joint that you're treating. So you masking that pain makes you start to use and put more stress on that joint that's already weak. And so you just cause more damage. And at the time when you suppress, and some patients, when they get the cortisone shot, they get relief for maybe a few weeks, sometimes not at all, but sometimes you get relief for a few weeks, sometimes, maybe a few months, but usually the pain comes back. Once the effect wears off, the pain tends to come back, and often much worse, because
Yeah.
now you've done a bit more damage to your body by masking the warning signal.
Right. I found it interesting. You said one of the adverse effects was that cortisone actually affects and weakens tissues. So not only are you masking the pain, you're also causing your body not to be able to repair itself as easy either because it's weakening
That's right.
what's hurt.
And yeah, that's right. Exactly. And remember that most joint pain, there usually is something structural. And when I say structural, the tissues that are holding things in place and giving support to your body. Just like in the building, right? When you have the beams and the pillars and stuff, those are structural uh, things in place. So when you mask the pain that is telling you there's something wrong with the structure in this joint, then you start to use that joint more and put more stress on that same structure that is already damaged and cause even more damage to it. And also, cortisone itself actually weakens bone and weakens ligaments and weakens cartilage. It makes everything weaker. Tendons become weaker. And so that is another layer of danger that you have, that you're inducing weakness in already weakened structures. And that's just not a good idea.
Yeah, no. So we've talked about kind of all the reasons why cortisone shouldn't be your first go-to. And maybe, I mean, eventually, I know that some people later in life get it because they don't want to keep fighting with shockwave
That's right.
or with physiotherapy and stuff. And it is going to just help with the pain instantly.
Hmm.
I do know of situations where people have gotten it and it's simply for that reason, that they're just in so much pain, and you go to an emergency room, cortisone
Yeah,
is what you're going to get.
that's right. Yeah,
Um,
and so for me, I mean, I've been a physiotherapist now for 23 years now, and I dabbled into private practice initially, but I felt I worked there for a few years, and I also work in the public sector in a hospital, and I still do. I just in the private practice though, in the private sector, I felt like there was something missing. You have patients and you need this modality that can actually help tissue. You know what the problem is, but you don't have the right modality to help the body heal, right? Often is what I find. And so the reason I came back into private practice was when I discovered Shockwave at on Pain Clinic. And so, and I found like this was the missing link that I've been looking for, something that can actually cause tissue healing and restoration of your tissue, right? And that's often the missing ingredient in everything that we do. You can do exercises, you can do stretches, you can do other modalities, but there's nothing quite like Shockwave in its regenerative capabilities. It's just amazing. And there's other, regenerative interventions out there like PRP and exosomes and things like that. Uh, but with Shockwave, it's non-invasive. You don't have to be injected. You don't have to be cut open. It's pretty safe, you know. And so, and
for the
since I've,
most part, it's pretty painless. Like,
yeah,
you have some
yeah,
sensitive spots, but
yeah,
it's
you're right. You
not
might have some discomfort, but the gains that you have afterward makes it worth it.
totally,
Yeah.
totally. Oh, I had a question I was going to ask you from what you just said, and now I lost it. It'll come back if it was important. But so if someone has a cortisone shot, can they still try Shockwave? And I remember when I first started, I was told that it needed to be like 6 months. And now I think things have kind of changed as we've gotten more information. But someone could virtually try Shockwave right away after cortisone. It just, we don't like to do that because it, you're already masking the effects, right? It's not necessarily because it's unsafe.
Yeah, that's a great question. So remember that shockwave works with your immune system. That's basically what it does. It's reprogramming your immune system so that your body starts to heal itself. It's communicating with your cells to get your cells to act and aggregate your resources to the affected region so you can heal yourself. So now cortisone is suppressing that process. So if you're already suppressing that process, you're not going to get the best effects from the shockwave when you administer it right after cortisone shots. So that's why we typically would say wait at least 6 weeks after your cortisone shot, where the effects are starting to taper off before you get shockwave. Otherwise, you're not going to get the optimal, the best result if you do shockwave right after getting a cortisone shot.
Right. So if someone was in pain and came to you, say, with a shoulder pain, is there ever a time when you would say, I think you need cortisone? Or would you always say, let's do everything else first?
Yes, it's always do everything else first. Make sure you've done everything. I mean, some people, shockwave is not often very well known, I find.
Mhm.
And so, as long as you explore all the information out there, and try to apply everything, throw the kitchen sink at yourself before using cortisone, because again, cortisone is not a long-term strategy, and it's not something that you should be taking over and over again. But there are cases where, again, you've tried absolutely everything and the pain is just debilitating and you just can't function. And but I find that that's not always the case. People don't always try everything. You
No,
know.
I mean, like I said, I didn't. When I was 15 and I fell on ice and I got coccydynia, and I had to walk around with a hemorrhoids pillow at school. It was a great time because I couldn't sit. And they did a round of some sort of pain meds or something, and then did a cortisone shot right away. And that I don't even think I ever did a single thing of physio. I don't think I saw anyone other than the doctor. Like it was just, and I don't blame the doctor or anything. It's more the unawareness just
That's
for
right.
ourselves. Like I
Yeah.
didn't know that I could do
Yeah.
something else.
You'll be surprised how unaware people, even in the health sector, are.
Totally.
And again, this is not blaming doctors. This is,
No.
if you don't know something, you don't know, right? And they have a specific training, right? So they'll offer you based on what they know, right? And even in my profession, there's a lot of um, people not aware of what shockwave is or how it works. So it's something that's just becoming um, more and more common in use in private practice. So, but it's again compared to cortisone, it's a safer bet. It's a better intervention with not just treating the pain, but also treating the underlying cause and causing some tissue restoration and remodeling. So, and it's safe. So,
Yeah.
I
And
mean,
not
it's
putting
just,
your body
there's
through.
no side effects.
Yeah.
So it's a no brainer.
Absolutely. Yeah, no, I think that that's why I wanted to do this podcast is because I look back, and me and my mom have talked about it so many times in the last 10 years that like after that cortisone shot I ended up with horrible back pain. I've never been able to like sit up straight since. I
Mm-hmm.
ended up extremely anemic. If you would have
Mm-hmm.
like touched my nose, I
Hmm.
was bleeding. Like it was
Well, yeah.
crazy.
Yeah, exactly.
Um,
Exactly.
and
Yeah.
so I wanted to do this podcast so bad for people to know that there are other options. Just because you've went to a doctor and you've said you're in a lot of pain and they offer you a cortisone shot, ask for a referral for physio, right? Like
Mm-hmm.
you can
Yeah.
ask.
Yeah. Exactly. Yeah. And, it's always a safer bet to try other interventions, especially something that can help, trying to address the structural issues in place so you can actually start to get. I can't tell you enough how many patients I've got. You always know where it's going to end up. Severe joint pain, severe arthritis, and it's going to end up with replacement or something. It's usually where it ends up. Like, so and it ends up in really bad. I saw one just yesterday. She is in her early 90s and she's had this shoulder pain forever. And she's got cortisone shot after cortisone shot. And when I tried to move her joint, the amount of joint restriction that she has was insane. Like she went and saw it, and typically at that age, you typically would not offer a joint replacement for somebody that age. But apparently, there's a surgeon willing to do that for her, and she is kind of hesitant about whether she wants to do it or not. Um, but when you just do the joint play movement, it's so restricted. And I mean, I didn't see any imaging report, but I can be almost certain that some of the muscles, like rotator cuff muscles, are either torn, or partially torn or completely torn, just from that repeated shear and strain on the joint. And every kind of movement hurts. She can barely even try to lift her arm up without pain. And
Yeah,
so
just because you've lived pain free doesn't mean that the issue wasn't there.
yeah, yeah. And I asked her even the cortisone, like, how did it work? And she got some relief, but she was always in pain, right?
Yeah.
Yeah,
Yeah. Um, so I want to kind of wrap up, but then I want to do a case study and see if you have any specific story that is like still stands out to you as to why you would tell someone like this is the story why you shouldn't do cortisone. But first, I want to kind of wrap up a little bit of what we've said so far because we've said a lot of information.
that's right.
So we've said shockwave is better because it regenerates and heals. Cortisone masks it.
That's right.
Has limitations about how much you can do and has more harsh effects on the body.
Hmm.
It might cause more issues long term. Is there anything else that you would like someone to take away from this as like their big shockwave rocks? Try it. Like,
I mean, you said it. You said some of the main things. Yeah, it's you're treating a symptom with cortisone. You're not really treating the underlying problem. So just understand that whatever relief you're gonna get is most likely gonna be temporary, right?
yeah, I guess
Um,
that's the big thing is
Yeah,
that
that's the
if
biggest thing. And then with my biggest concern is with long-term use. Sometimes, you get hit with one, in some cases, you get hit with one dose of cortisone and that may be enough, but rarely is, right? You often would need another. And that's where I get concerned with that repeated exposure to steroids. It's just not a good idea because of all the things that we listed. It suppresses your immune system. So then you can catch some kind of opportunistic infection, right? And then it weakens your same very connective tissue that you're trying to protect. It continues to weaken them. So your bones, your tendons, your ligaments, they get weaker, right? And then you can cause nerve damage. So you can start to have neuropathy and altered sensation. And then you can develop hyperglycemia. And then as your example that you gave for personal example, where you can start to cause a coagulopathy, where you have the propensity to bleed. It can cause high blood pressure. It can cause changes in your skin especially around the site where it was administered. And so, this is just not a good idea, right?
Yeah.
Especially for long-term use. So, whereas Shockwave is safe, and it would actually induce some healing in addition to treating the pain. And once you get healing, then pain will start to subside as well, right?
Yeah, exactly. Like it's one thing to use cortisone for a one-time pain relief. You're about to leave on holidays and you
Mhm,
can't get
mhm.
in for physio and shockwave
Yeah.
because it's is it common to see instant relief after one treatment of shockwave?
Yes.
Or
Yeah,
yeah?
it is. Yeah, you can get instant relief. Sometimes take a couple of treatments, but sometimes you just get. Now, often, sometimes too, when you administer a shockwave, we can feel a little bit sore for a day or two. Usually subsides after about 48 hours, and then you start to feel relief. Or sometimes we'll take a couple of treatments. And with the way shockwave is done is typically you don't need to get 3 treatments in 1 week. Typically, you would do like one treatment in about 5 to 7 days, and so you can get one treatment a week, right? So that tends to be also cost effective that way. You don't have to keep going back and forth to the clinic multiple times a week and disrupting your lives as well. And so, yeah, so anywhere from 1 to 3 treatments, you should start to feel some relief.
Is there any contraindications with shockwave?
Um, so, I mean, if you have fresh trauma, especially where there's bleeding in place, when there's uh, displaced fracture, things like that, then yes, you don't want to be administering shockwave in that region. Other than that, no, or if there's internal bleeding, right, that you're aware of. Yeah. But other than that, no, it's pretty safe intervention, especially again at the doses that we administer. It's pretty safe. And just knowing, and there's different kinds of shockwave. There's the radio pressure wave versus the electromagnetic and the electrohydraulic shockwave. So knowing different kinds of shockwaves and their application also makes a difference. And often we tend to use them in combination, right,
Right.
to get the best results. So, but yeah, typically very, very few contraindications, if any, for shockwave.
Pretty safe for everyone.
Very safe. Yeah.
Yeah, I think that's the perfect wrap up that you said was that cortisone is going to help with the pain, shockwave is going to actually fix it. And that's the big thing for people to be aware of is that if you need something quick fix, it's one thing. But if you want to actually start to feel better and you want to actually not deal with it for forever and you don't want to go to your doctor twice a year to get a cortisone shot, you don't want to have those risks, definitely try even just manual physiotherapy. I mean, we obviously are huge proponents for shockwave here, but you're a physiotherapist, they can come see you and just do manual physio is going to be better than cortisone.
Mm-hmm. Yes, for sure.
So, do you have a story that is like what you would share of why someone shouldn't do? Like, do you have a story in your head that's kind of a little close to your heart, one that you've
Mm.
seen, maybe personal?
Yeah, so as I mentioned earlier, I also work at the University of Alberta Hospital. I worked in the ICU there for 16 years, and I currently also work at the Mazankowski Heart Institute. So I see regularly cases where cortisone is administered for joint pain, and then they develop septic arthritis, uh, and the one that I saw more recently, a couple of months ago, was a lady who was having severe joint pain, limiting her mobility. She was in her 60s, mid 60s, and she's very vibrant at heart, but so not being able to get up and walk around was definitely starting to weigh on her, and she got a cortisone shot. Um, and then she developed multiple joint arthritis. So it was her knee pain that she started with. And then she developed arthritis in multiple joints, including her left shoulder. And then the worst one was she developed infective endocarditis, affecting a couple of valves, mainly her mitral valve in her heart. So that's the valve in the left side of the heart. And it was life threatening. And they had to take her into the operating room, and they had to actually replace her mitral valve with uh, a tissue valve from a cow. And but that's what saved her life. And just to think that she went from just, you know, a cortisone shot to that. And when I started working with her, she was still having the joint pain. So the joint pain was still there, right? And
Yeah.
very debilitating, very painful. But now she had now inherited all these other problems, including the shoulder problem, severe shoulder pain. And when you try to move her shoulder, it was like very grindy and restricted. And then she also has this cardiac issue that she just had to cut her open, crack her chest open to do this procedure. So you can imagine how life changing all of this was. And we worked with her in the hospital for probably about 5 weeks, and we weren't making a ton of gains with her. So it didn't even look like she was going to be able to go home. It looks like she was probably going to end up in a long-term care center,
Yeah.
right? And this is a lady who came from home. And so just look at how her life just kind of turned around just after getting this shot. And those kind of cases just really weigh on me. And I'm really glad that we're doing this today, because I think people need to know. I understand that people are in pain, and when you go see a doctor, you're just looking for anything to get you out of that pain. I think people should know what they're getting into, and maybe every now and again cortisone may be required, but you need to know what you're getting into, especially with repeated use. That's the main thing that I'm concerned about.
Yeah. Yeah, I think it's just spreading that education. At the end of
Hmm.
the day, if you want to get a cortisone shot because you want that quick relief right away, like absolutely do it. But knowing what it could do to your body, knowing what your other options are, knowing just what you're actually getting, I think is huge, because I think that that's the main thing is, I mean, we're all guilty of it. You go into the doctor's office. I didn't even take biology 20. So when a doctor starts talking, I just nod my head. I'm like, yeah, sure. Whatever you're saying. Right.
Yeah,
And
exactly.
so being able to educate yourself a little bit more. And that's what our whole podcast is about, is
Hmm.
as much as we're here to help, someone across the globe could be listening to this and it can help them realize that, oh, maybe these cortisone shots aren't what I should be doing, even though it's making me feel better at the time.
Hmm.
But
Exactly.
that is a very heartbreaking story, and she really got every adverse effect and that seems to possibly happen, and that's awful.
Yeah, yeah, yeah. So yeah, those are, and these things happen every day. Like these are just a few that we're aware of, that they happen all the time.
Yeah. Yeah. And I mean, so many people don't even realize what happened, that
Yeah,
they don't
yeah,
put two and two together, that
that's right.
all of a sudden this started happening after I got my cortisone shot.
Hmm.
Interesting.
Hmm.
So,
Yeah.
yeah, no, this was fantastic. Do you have anything else that you want to wrap up with? Anything that I didn't ask that you're like, I want to say this?
I can't think of anything. I think we covered pretty much everything. Yeah, so yeah, this is great. I enjoyed it. Thanks for
Yeah,
having
no,
me.
this was awesome. Thank you so much. I can't wait for people to hear this and just be able to make some educated decisions when they're in a doctor's office, because that's what it all comes down to. So
That's correct. That's correct.
thank
Thanks,
you so
Gil.
much.
Yeah, thank you.